Have you ever experienced a sudden rush of overwhelming anxiety and fear? This sensation is at the heart of what is known as panic disorder. This disorder is characterized by recurrent, unexpected panic attacks. Picture this. You're going about your day when suddenly you're gripped by a surge of fear. Your heart races, you start sweating, shaking, you might even have shortness of breath. Some describe it as a sense of impending doom, or a feeling that something terrible is about to happen. There is no immediate danger, but your body is reacting as if there were. It's as if you're in the middle of a horror movie scene, but in reality you're just sitting in your living room. This is what it's like to live with panic disorder. It's a frightening and complex mental health condition. In the next few minutes, we will delve into the symptoms, causes, and treatment of panic disorder. So what does a panic attack feel like, and how can you recognize it? Imagine this. Out of nowhere, your heart starts racing like a runaway train. You're drenched in sweat, your hands are trembling, and it feels like you can't catch your breath. You might even experience sensations of choking or smothering. This is no ordinary bout of anxiety, this is a panic attack. But it doesn't stop there. You're suddenly seized by an overwhelming sense of impending doom or terror. You feel detached from reality, like you're an observer of your own life. Or you may fear that you're losing control or even going crazy. These symptoms can be quite frightening and often occur without warning, which can make them even more distressing. They're not just in your head. They're real physical responses that can feel incredibly intense and even debilitating. Recognizing these symptoms is the first step towards managing panic disorder. What causes these terrifying episodes of panic? Many of you might be wondering about this question. While the exact cause is still a mystery, there are several factors that might contribute to the onset of panic disorder. Firstly, genetics could play a significant role. If you have a family history of panic disorder, you could be more susceptible. Secondly, stress, especially chronic stress or traumatic events, can trigger panic disorder. It seems our mind's response to high-stress situations might lead to these overwhelming feelings of panic. Also, changes in the way parts of the brain function might be involved. Specific areas of the brain responsible for fear and anxiety might react more intensely in people with panic disorder. Lastly, it's worth noting that panic disorder often begins in late adolescence or early adulthood. This could suggest a link between hormonal changes and the onset of panic disorder. While the exact cause is unknown, several factors might contribute to panic disorder. Is there a way to manage or even overcome panic disorder? This question may linger in your mind, especially if you or someone you know is grappling with this condition. But take heart, there are indeed effective treatment options available. One of the most effective treatments for panic disorder is psychotherapy, specifically cognitive behavioral therapy, or CBT. This therapeutic approach teaches you different ways of thinking, behaving, and responding to the feelings that come with a panic attack. It focuses on the thoughts and behaviors that sustain or trigger the panic attacks and helps you look at your fears in a more realistic light. In addition to psychotherapy, medications can also be a helpful part of the treatment. Antidepressants, for instance, can prevent panic attacks, while benzodiazepines can help reduce symptoms when they occur. However, it's important to note that medications should always be used in conjunction with psychotherapy and not as a standalone treatment. Self-care measures also play a significant role. Regular exercise, adequate sleep, and a healthy diet can contribute towards managing panic disorder. Avoiding caffeine and alcohol, which can trigger panic attacks, is also recommended. Remember, it's important to seek help if you're experiencing symptoms of panic disorder. With the right treatment, you can live a normal, fulfilling life. Overcoming panic disorder may not be easy, but with determination and the right support, it is absolutely achievable. We've taken a journey through understanding panic disorder, its symptoms, causes, and treatment. We've discovered that panic disorder is a serious condition, but one that can be managed with the right help. Remember, it's okay to seek help if you're experiencing symptoms. Knowledge is power, and understanding our own minds is the ultimate power. Spread awareness about mental health. Subscribe and support Democratizing Neuroscience, powered by GloNeuro.